Hello, everybody. Good afternoon. Welcome. Been busy lately. This is one of the things that I do. I do come just to announce things or answer things or um, find the resources that I have for people to use them and get better. Wellness wise. Okay. Of course, people with medical problems, people with real personal problems, they communicate with me. That's something I appreciate, and then I try to do the best I can. And those things go very well on Zoom and um, personally coming on these rooms, all those things, right? Which is very good. Okay, I welcome that. But apart from that, I do come and address some general issues on this Dr. Robin service method, whereby I can really express my perspective, my attitude about life, about how it is. There's a somebody who is undergoing surgery, and they just had a communication with them. They're afraid and scared about the surgery, but it's a life saving surgery, right? Life giving surgery. So you look at that as an opportunity, and also you don't react to the loss rather than opportunity to serve the life and really contribute and live well. So that is the attitude we need to take in some situations like that. So all morning has gone with that particular situation, but that's the service that I I'm happy to provide, because psychosocial help is okay, but then understanding ancient wisdom perspective of what is life, what is important in life, and how do you narrate to all that. So that's very important too. Hopefully that makes sense to a lot of people who are coming to my way. So today I'm here to really tell you about why I take this proactive wellness so serious, and why. I'm doing workshops every month for a few months on the fourth weekend. Even this month also we'll go to the fourth weekend because earlier was very soon. We wanted to do this weekend, but I kind of postponed it the fourth weekend. And that workshop is about really assessing yourself. I will provide the tools that you could assess yourself, not right there. You can do some gross things maybe, but even the subtle things, even the personal things, even the things that you cannot discuss in the group, all can be done privately. And when you really focus like that, you will be able to really understand where are you at in terms of wellness. How do you feel psychologically? How do you feel mentally and spiritually? Where are you at? What are you doing? What is that going on in your life? All that can be assessed. It will always start with the physical health. It goes into mental health. It goes into your social health and also your perspectives and all that. Once you have a comprehensive, you know, kind of just reviewing the whole being of yourself, then you can find some areas you could improve, some areas that could definitely improve, some areas you need help now. Okay, that kind of thing. And then one of the common things I get is people go crazy in their head because they are working too much or they are having too much data. Even the doctors also, when we go in the morning, we're so fresh, but the time 50 patients are done in the evening, you kind of have this brain reeling, right? And so they ask me, what do you do with that? What I do? I just tell them, go have a relationship with the nature. Go walk and enjoy the nature. That itself kind of gives them sort of relief from their own chatter in their mind, right? It may look very simple, but it is something that we are missing lately, right? So that's not the artificial entertainment, but the natural healing energies that out there with the trees, with the wind, with the light, and all that. That's very, very important. But we don't seem to remember that on a daily basis. So have a relationship with the nature on an ongoing basis, and you will have so many riches that you will discover, which are healing for your mind and your heart and also your body. Walking, good exercise, right? You can walk briskly. You can lift your arms up. You can really say that you are walking in a straight line. All these things enhance the physical activity, and also the stretching of the large muscles really help your mind calm down too. So it's all question of being natural. Okay, if you are natural, if you are really with the nature stuff most of the time, you will have to have this brain fog or information overload or uh, not able to concentrate, any of that, or neurotic, just going thinking, you won't have it, right? So so remember that, and then you will be able to really have a revisit your relationship with the. So this weekend that we are going to spend is going to have 4 sessions. Uh, Obviously, each session at least 3 hours. So you can spend time leisurely about your uh, wellness journey, wellness status, wellness methods, wellness ways of modern science and the ancient wisdom, and then have a recipe for you, what is really customizable for you, those kind of directions we are going to give. And then you will be able to really appreciate them, and also uh, really take advantage of that, right? So that's the intention of this. So I have prepared an assessment for everybody. That includes your histories, your allergies, your medications, your health problems, chronic problems, your family problems. Family may have a lot of medical history. That's important to understand. So like that, the assessment in a systematic way we do in any patient presenting to us. But this is done with a wellness perspective. You may not have any active illness, but you have indicators of what is going to be. You may be stepping into long-term illness, but the body is warning you, but you are not paying attention. That kind of thing. So that complete assessment, full assessment. For example, you have problems with social relations. You don't know how to make friends. You don't know how to be useful to your friends. You don't know how to really recruit people at no notice when you are needing something. You need support. You need psychological help. Lots of things like that. In this nuclear families and everybody living by themselves robs us that social support that normally we get, right? So we will go to. So you can see the spectrum of wellness I'm kind of spreading. It's not just physically feeling well, but also mentally kind of joyful, mentally kind of focused, and really able to have good emotions where you are not angry or envy towards other people, but you have an attitude of friendliness. See, so it's all question of understanding all that. So don't worry about things and just take action for them. A lot of people go, merry-go-around without any botheration, but some people take things very seriously and they react too much. All those aspects I want to address. I want to address how do you live daily life? How do you participate in discussions that involves important aspect for you in your life. Lots of times we don't educate ourselves, we don't make ourselves aware of what is going on and what is that could be and what can be done and how you can prevent damage in the long run. Okay, that is true with joints. If you don't walk and you have arthritis, that's with the muscles. You don't do physical work and then you don't do anything to keep your muscles in shape. That's a problem. Okay, like that. So body, mind, heart, and also your spirit. If you address all those areas, you'll be much, much better. Okay. So there you are. This workshop is going to be 4 sessions, starting from the morning lunch break and then evening session. First session is going to be purely assessment, addressing all questions regarding assessment. How do I assess myself? How do I recruit my provider? How do I get information from my medical records? All that will be addressed, and so that you are not relegating to your healthcare provider to really keep tax, and then you don't know what's in that record. Rather, you will know what is in my record, what is going on, what are the processes, and all that. Then, once you have a good assessment of wherever you are, and then you take it, and the second session we will go and see. Maybe some people want to come out and tell, or if I will do generality, suppose you find this, like that. So you can have, without revealing anything to anybody, you can have some guidance or some awareness aspects of issues, right? Physical issues, mental issues, or belief issues. So many things are there. Then you'll know, okay, this is going on with me. My father had a heart attack, my grandfather had a heart attack, so I have a possibility of having this. And the risk factors of that are male or, number of cholesterol, so blood pressure, all those things, right? Smoking and all. Once you have a general review of what are the prevalent diseases, which is what is killing us most, like a heart disease, cancer, and all that, you have a general. idea. Obviously, you may have it, but we will take it a little further to see what you can do from what you found in your assessments. That's the second session. And the third session is like a what are the things I can do to fix these issues that I found, right? And then that is going to be a pretty big deal. So it will take the last two sessions. Not only modern medicine wise, when we should get a checkup, when we should do follow up, when we should do uh, really active participation in my care. That means you know what the doctor is thinking, you know what the situation you have, you know what are the things planned for you, and what the consequences of those. Suppose you take medications, you have adverse effects, you have interaction with other medications. Like basic from that, everybody knows. Too, it's going there. Can I do this thing stuff without much medication or less medication? That is where the ancient wisdom comes, where you are going to be in nature and you're going to be working with your commonsensical time tested things, not a snake oil but more like you got to do your homework, you got to do your work that you assigned, so doctors may say take these pills, and then they may not be able to advise you on diet or exercise or mental health because they think it's not their job. Majority, I'm not saying everybody, majority. But we also school ourselves to really see how can I help with all these other things in an integrated way. That's the kind of thing I like, So for myself, I never leave my decisions of my health to the doctors only. I take their input, I take their knowledge, I take their expertise, but eventually I want to make a decision for myself. And I want my patients to be like that, so that they know what's going on, what is available, what can I do, and what are the consequences of whatever treatments I get, it takes time, you think, but then if you are oriented towards your own body, mind and soul and everything, and you discover these things very early because you are aware of it. For example, you are taking over the counter medication of Motrin. You think, oh, painless, I want to be painless, my joints are aching, so let me take a couple of them, and you get used to that, and then that Motrin can also cause bleeding from your stomach. If you are aware of it, then you will notice that if there is a bleeding in your stool, or you will use less of that medication, or you may not want to use at all that. Okay, that kind of thing. If you take Tylenol, if you take too much Tylenol, like a every 4 hours too, like a 8 or 10 or like that, that can cause problems with your liver. Just be aware of these medications, the common side effects, common things, and then not just taking blindly, or you're not just taking just for the simple things that you could put up with. Then you are aware of what is the treatment available, all the treatments, and then how can suppose you are a complicated lymphoma or something like that, then you want to study about it, you want to take help from the literature, and also ask your provider to help you understand your problem better, and also plan your treatment with awareness. Experts are experts, they will provide the knowledge, but then when it's applicable to you, you need to play a role in that, you need to have a say in that. For that, you need to be educated, aware of what's going on in the field, what are the things. For example, you go for a surgery and you have a Da Vinci system in the hospital. That's a wonderful thing. It is very precise, very well done, and operator risk is not there. So you do much well better than somebody who is doing routine. Okay, so choosing the surgery for what you have is important. Then there is a discussion too. Otherwise, people may do things that are not really effective, maybe, maybe you don't get the function back and all that, right? So understanding science, understanding where the science breakthroughs are coming, understanding where the implementation of hospital is happening, understanding high technology, how it is helping us, all these things, casual interest. You don't have to know every detail of it. For example, if I go for somebody has a atrial fibrillation, and I send them to invasive studies, and then they go and study, and then they do the mapping of all the stimuli, and they identify this is the one where he has problem. They go and burn that, right? I need to know details of that according to my interest. I kind of a lot of enthusiasm, lot of curiosity about so many things. So I always get into everything and then try to learn with the hope I can give that knowledge to my patient. There are many number of doctors who are there, but now you have an additional big help coming on. This is the AI, artificial intelligence, that is got agents. Four agents combined together like four subspecialties. So wonderful systems are coming, and they are all oriented to personalized medicine. So once you are oriented towards that high-tech achievements, high-tech information, and using them in a productive way for the patient's health and welfare, it's going to do wonders. So I'm very excited about the possibilities of AI in healthcare, and I'm already schooling myself in a major way. So whatever I educate, as long as I live, I will share, and then hopefully my audience, my friends, my colleagues, my family, they get the benefit of that. Okay, so it's a wonderful thing. You can have four AI agents, and you can have four specialists. The specialists are not going to compare with these agents, because agents have the uh, luxury of reviewing thousands and thousands of articles in a fraction. These four specialists, even they spend their lifetimes, they may not be able to do. But they need to interpret the data that was produced by AI, and the doctors will be able to do that interpretation, where the art of medicine comes, where what is the patient, what does he have, that kind of thing. So it's kind of enhance our healthcare if we use them properly. Okay, so we will discuss all that. So, and the second day, both sessions will be what we found on the first day, and what are the things that are available for us to not only cure the problem if you have a problem and they have a cure, or reduce the problem if you don't have a cure, and enhance the quality of life, and also eventually living. The whole purpose is to live longer, live longer, well, not in illness. Just surviving with medication is not counted. And then not only just live longer, but live in joy. That's what I'm hoping to do. So this workshop is going to be immensely beneficial for you. Uh, if you come and participate and stay all the four things, then you have cut down a lot of aggravation for you or suffering for you. That much I want to do, so that people will get benefited from this. Okay, every fourth weekend that I'm going to do this for a few months. See how the response, how the results are, and if they are working out very well, I'm not going to exclude your doctors. I'm going to complement, supplement, and augment their care, and also really help you to understand the situations of the healthcare related insurances, healthcare related navigation through the system, healthcare related what are the proper things that you go for, not living in fear, not living in something like obsessive about it, but be commonsensical, be really, basically, you're going to be empowered with a lot of tools that will help you to be proactively well. That means you're going to be well for a long time just by your measures of proactive attitude. Okay. Hopefully this appeals to you, and anybody has questions, you can come up now. Harry. Hi,
Namaste, Dr. Earl.
Namaste. How are you, Terry?
I'm very well.
Okay.
And yeah, um, okay. Our practitioners and things like that. Now, I might have told this story to you before, I'm not sure, but I have mentioned it on the app before.
Mm.
About, how many years ago was it? 9 years ago?
Uh-huh.
My knee
Mm.
swelled up twice its normal size, Dr. Earl. Yeah?
Wow.
Yeah. And it became the problem was I had trouble getting out of bed in the morning because it was quite painful,
Mm.
and I was walking with a limp, Dr. Al. Yeah.
Yeah.
So I went to my doctor, and they sent me to a hospital to have X-rays and things like that.
Mm.
And anyway, a few weeks passed, Dr. Al. I still had a swollen knee. I was still limping. And it took me about nearly 5 minutes some mornings to get out of bed. It was all right once I was actually moving. It wasn't so bad. So anyway, I thought, why haven't I heard anything? So I phoned my doctor to the practice, and one of the nurses there answered the phone, receptionist, whatever, and said, they never found anything wrong. So I'm thinking, hang on a second. My knee is twice its normal size. I can only walk with a limp. There's nothing wrong, Dr. Al, you know. So anyway, synchronicity always comes into play. And one of my work colleagues says, oh, have you tried apple cider vinegar, organic apple cider vinegar with the mother? So I thought, oh, no, I haven't heard this before. So anyway, I gave it a try. And I started taking a few spoonfuls of apple cider vinegar every day, yeah? And within a week and a half, Dr. Al, I got out of bed one morning and I noticed my knee wasn't as swollen as it was. And within a few days, I was back to normal. The knee was its normal size. I was walking normally, Dr. Al. What do you make of that?
Well, as a medical doctor, I would have established maybe your swelling can be aspirated and they studied under the microscope for any gout. That is something easily stateable. And also, if you have some rheumatism, so many things we look for, right, in the synovial fluid, and that would have given us some answer. But that is the problem. The system doesn't follow right away, doesn't give us appropriate answers because of the bureaucracy, the way the mental everything is set up, and people may miss the X-ray reports and all that, right? So what I teach my patient is be proactive. Call right away. What happened to my X-rays? What happened to my results? Is there anything you can do? I still have this. So that is the proactive behavior of quick follow-up. Many people call me even now, Terry, from India, from other places too. Lots of times they let it other people decide and tell them. But these people are so busy, sometimes they don't intend to neglect you, but you are lost in the system. So you got to understand that navigating how do you do, okay, I have this problem, I want an answer. I want something like what is the reason? Can I fix it? If I can fix it, what are the things? That's what I'm trying to empower patients with, so that you know what is going on with you. And then you understand something goes wrong, don't wait longer and don't let people neglect it for long. If you go to the healthcare system, they may just do for the visit and then they expect you to come back next visit. For me, it's not like that. I'm not an episodic doctor. That means each episode is 3 months. I'm like a all the time doctor. That means my patient can be the swelling of the knee. What's going on? Why? There should be a reason. You see, lots of times these grandmother tactics like a vinegar and all that, they were tested and tried for several things in the past, and they enabled healing. So some of them may work, may not work. But we cannot say yoga works for everything like that. No, we want to use that as part of the treatments, but not necessarily that's going to be a panacea, right?
Thank you, Dr. Al.
Yeah. So I think that's a very good example Terry brought up. Is like sometimes there may be just inflammation, and there may be arthralgia, which is just swelling of the joints because of inflammation. But if you dig deep, there will be a reason, there will be a cause why we should be paying attention to that. So this kind of, the patient goes to the doctor, and the doctor sees it and then assumes everything gone because he has done testing, and but he has not followed up with the testing results with the patient, tell them what is going on, or ask him, do you feel better or has they come down? Or sometimes some conditions they flare up and they go down. So you have to understand how the arthritis works as a whole. You don't have a doctor for that, but you can have information looked up. You see, especially with the artificial intelligence is going up, you could just go and put your symptoms and there are the patient, your age and everything, and describe the patient, and then to give you a possible diagnosis. But you have to do those things to confirm it. Then you're armed. You are armed with information. You don't have to go and argue with them. You can say, could this be this? Could that be that? And the doctors who are seeing this arthritis in many years, they have seen variety of them. They have seen what is common, what is not common, what can be done. They will have to. It's more like an empowered patient is much better than ignorant patient. And then you will take whatever they give it to you. Don't be like that in this modern age, in this time of science and ancient wisdom. You have so many things that you could do to nip it in the bud. He went to the doctor right away, right? And he is owed an explanation of what was going on, but why they could not find. They were looking for something, they made it, but then they did not aspirate the knee. The fluid could have been studied, then we could have known whether it is infective or whether it is inflammatory. Accordingly, we will classify that, and then we look for other things too. So whatever it is, you have a condition, you are discomfort, and you go, just testing is not enough. You got to have an answer in reasonable time. For me, as soon as possible. Okay. Once you are oriented like that, you don't have a nasty patient, but you can be a very educated, empowered, really knowing what is going on, and then participating in your care. That is what I'm preaching. Proactively be well. Understand what is wellness, any deviation from the wellness, what are the things I can do to restore back to my wellness. That's what we are doing. Okay. So that's an example. So those kind of things we're going to take up, and then we're going to talk to people and encourage people to be more aware of their conditions, their discomforts. Women especially, a lot of times they put up with a lot of problems. Uh, People dismiss, oh, there are women's issues and all. Lot of heart attacks are missed in women. Even now, the awareness in the women population about heart attack is much less than men. Even the approach of the medical providers is like that. Don't have to be. Don't take it like that, because you are deserving to be found out as soon as possible and fix it as soon as possible. That is not being done. Then you take proactive action. You take like many number of people that call me, usually they have so many things that they could do, they don't do, and then they kind of allow the doctors to call them whenever they can. Lots of times they're overwhelmed, they have too many patients and all. But still, if you follow a certain principles, like me, what works for me is I will not rest till I have an idea about what's going on with my patient. Up until then, I will be doing the workup and all. Once I know, once I initiate treatment, once he's taking it, that's when I can relax. But I will not forget the patient like that. If I know somebody came with a complaint, and I kind of thought about different things, and I ordered a lab test or whatever it is according to the protocols or according to what it is, then we will be really looking at that. Is there something we can do? And if that is answered, then I know what I can do. Then I started, then I follow up appointment and all. Then I can relax. Otherwise, I will be. That's why this episodic care is really not good for us at this day and age. It has to be continuous care. When I was trained as a young person, we used to take calls very lengthy. 3 days in a row, we were on call, 72 hours. I remember very well. But then we have all the information of the patient with us. So we were able to help them for a long time, being their provider, knowing them, knowing everything about them. But now people change, shifts every 12 hours. So after 12 hours, you don't know what's happened to the patient unless you actively take interest in that. So the system is grown like that, and they are more about acutely ill people. When they come in, they take the symptoms, they fix them, and that's it. They don't really have a clear cut, good follow up in the chronic diseases. They may do 3 months, they may do 6 months, they may do annual visits. That's not enough at all. So, who is the best to really pay attention to that? You educate yourself about the things you have, potential for things you may have in the future, and also what are the treatments available, how can I get them best, or what are the things I can do to prevent this thing going into further degeneration, that kind of thing. I hope you got what I was talking about. Anybody who agrees with me, come up and tell me you are doing that. I'll be very happy to listen to that. You know. Some people do, all these coaches on the new vibe, they all advocate a lot of good things. I hope people are listening to them and following them and doing those things. But the important thing is how empowered you are about your medical conditions, how much you know the solutions available already, and how much investigation you have done about them. And when you go there, did you have a good discussion with your provider? Not to harass them. I'm not advocating that. What I'm saying is, uh, be a partner in your wellness. Be a partner in your health and well-being for the long time. What you eat matters, how you exercise matters, how you rest and sleep matters, how you keep your mind in a proper way is matter, how you keep your heart friendly, loving, kind, and all that matters, how you relate to the society issues matter. So many things. Just don't absorb all the information just like that, but be selective, be proactive, be elective about what is good for me in the long run. Okay. So I'm going to do this workshops on a monthly basis every fourth weekend. We thought, 2 days, but the whole thing need to be attended by people so that they can take full advantage of that. If they are already doing it, fine. But if they are not doing it, it's better to pay attention to this kind of. It's not just educational. It's like establishing some health habits, wellness habits. It's about empowering yourself with the latest information and the resources. How do you follow that and all? So that kind of thing, if you understand, if suppose somebody asks you, what are the number one cause that is in America that killing people? Everybody say heart disease. Okay. What is the number two? Cancer, like that. But what are the number one miss that doctors have? Mainly, a lot of people could be diabetic, but they allow the diabetes to grow for a long time. They don't come to the doctor. When they come to the doctors, they may come for something else, and they're taking the blood sample and they do incidental finding of the diabetes, and they may start to treat and all that. What I am educating is you should have been picked up on that much earlier, you know and then you should have, because nowadays you can check the blood without really puncturing your finger paste, and then the iPhone will tell you how much is your blood sugar right now. So understanding that, suppose your mom and dad has or your parents, grandparents had diabetes, you may want to understand. I may have those genes, but I don't have to necessarily reflect on them. I can just be proactive about it, understand the disease. That's one way I use this knowledge spreading is somebody comes into the hospital with a diabetic coma, and then he's in danger, so we have to put him in ICU, and then we do a couple of days up there, and then lots of times we reverse that, right? But then there are so many kids, so many grandchildren, communities, friends, so many people come there, right? I take the opportunity to tell them this is what happened to him. You could prevent all this if you know what is diabetes, what should you do. I'm just using a very common example, like that. Everything else can be done. Not all of them can be fixed, but at least we can know, and then we can limit their damage with proactive behavior, right? So I hope you are getting my drift, what I mean, So I want people to be more using artificial intelligence, more exploring their own conditions that they have, understanding the mechanism of the medication that they are giving, understanding what are the side effects, interactions, and really work on everything that they have, and they have their lifestyles. So, what are the lifestyles that are promoting this kind of illnesses? All that. So, be well informed, empowered patient, and employ all these wellness measures that you are learning. Then you can keep away health system away for a while. Okay, or use very wisely the health system. Okay. I'm not being, presumptuous, because a lot of people are going to lose insurance from these new bills that people are passing, and many people are better off taking care of themselves before they become sick. So this is going to be a need as you go on. So what I'm saying is, be intelligent, be empowered, be really proactive about your wellness, discover and attend to them early, nip them in the bud. That is the best thing for lot of cancer, lot of disease also. Suppose you are a person who is sitting down all the time, and you develop knee swelling, like Terry was talking about, and you want to really reverse that. Get up from the sitting 1 hour, 2 hour, and walk around for a few minutes, and come and sit down and do that. And also there are exercises they can do. But then, even if we don't do anything, just get up and walk around and come back and say, that takes away a lot of that sitting bad effects that can happen from the prolonged sitting will be taken away just by getting up and walking around the room. So it's as simple as that. So, but a lot of people get used to the comfort of sitting down, the laziness that gives you the tamas energy I talk about all the time. That is breeding that kind of bad energy, and people are slave to that after a while, because that dominates them. They cannot get out and walk. They cannot really have an exercise session. But when they have a problem, when the doctor prescribes this exercise, they may do it. But what I'm saying is, even before all the problem blossoms, kind of attend to that. Okay, this is the I'm also doing every month, mainly because I want people to get on this movement of proactive wellness. That means everybody takes responsibility for their wellness and health, and everybody kind of studies, understands, and gets the information about that, and also change their lifestyles and live well for a long time and enjoy. Okay. Right now, people are getting 3 or 4 chronic diseases, and then they kind of go into nursing homes, and then they are maintained by medication, but they don't have any quality of life. Whenever I go to nursing homes, I kind of get very depressed seeing that, right? So, anybody else, or we can close the room. So I'll be coming on one of these, like I usually come on whenever I have time. I will be telling you about what's happening, and you will see the brochures also to sign up and come to the uh, workshops. Okay. So one or two persons change by my workshop, I'll be very happy. But the more people are engaged, empowered, and enlightened about their own conditions and solutions, the better it is. And also, we're spending so much money on healthcare because of this casual attitude about health and wellness, and it's going to be pretty tough down the line to put that much of money. If you think, oh, I kind of live my life and I have insurance, when the problems come, we will take care of it. That is something not a very wise thing in this day and age. In this day and age, information is so easily available, so much at a fraction of a second. It's going to be much more easier, and you can do a lot of stuff on your own, and you can recruit doctors also online, and you can get suggestions and everything very easily. Okay, so information explosion is happening. Use that properly. Okay. All right. With that, thank you, and I'll see you back again whenever I can. Bye.